Oh, this changes every time. Okay. I'll just go. Okay.
Okay, yep, sounds good.
Okay. Hi, my name's Duncan Andrus, and I'm a pharmacy intern. Our 74-year-old patient, Ray Cancella, is in clinic today for his 3-week follow-up, and he has a chief complaint of chronic pain. He started the Norco 5 milligram per 325 milligram, 2 tablets by mouth every 6 hours 3 weeks ago. Since then, he's noticed an increase in constipation. And this patient is on a total MME of 40 per day. And his assigned sex at birth is female. And his past medical history includes osteoarthritis for 10 years, hypertension for 20 years, obesity for 15 years, seizures for 12 years, chronic kidney disease stage 3 for 5 years, and gender dysphoria for 25 years. The patient has been retired for 10 years and prior to retirement was working in a labor intensive field. And he also has complaints of pain in the right knee and the right hip, and shooting pain down the right side of the groin. The patient also complains of nausea on occasion, stomach cramping, having low energy, a little bit depressed, and feeling very sleepy. He states that the pain is worse in the morning and the joints feel stiff after waking up, um, until about breakfast is usually when it gets a little bit better. And then throughout the day, it also gets a little bit better. He rates his pain score as a 6 out of 10, and the patient's blood pressure today is 148/89. And his physical exam revealed that the patient is obese with back pain radiating to the right buttock and right hip pain with flexion. Right hip is also tender to palpitation, and the right knee is positive for crepitus, and gait is impaired secondary to hip and knee pain. His X-ray also showed advanced degenerative changes at the L3 through 4 and at the L4 through 5, as well as moderate degenerative changes with some spurring of the femoral head and slight decrease in joint space of the hip. He also showed moderate degenerative changes with no effusion in the right knee. His AST is elevated at 38. His serum creatinine is slightly elevated at 1.8. His GFR is low at 42, and his ESR is normal at 18. All other labs are either within range or aren't pertinent to this case. And based on the pain in only the right-sided hip and knee, and then the fact that the assigned sex at birth is female and the increasing age, the diagnosis of osteoarthritis, those can help confirm the diagnosis of the osteoarthritis. The pain in the groin is likely not from the osteoarthritis, because it's neuropathic in nature and described as shooting pain. And there's no evidence of pain, swelling, pitting, or flaking in the fingers can help us rule out the rheumatoid arthritis. And then the normal ESR and the fact that the pain is only one-sided can also help us rule out rheumatoid arthritis. Um, and then the no pitting or flaking in the fingers or swelling in the fingers can also rule out the psoriatic arthritis. Since he still has a pain score of 6, the problem is inadequately treated, which leads to our problem being labeled as inadequately treated osteoarthritis of the hip and knee. Some goals for this patient include decreasing the patient's pain level, decreasing the adverse effects from the treatment, increasing the patient's physical activity level, um, returning the patient to having regular bowel movements, and return to normal day-to-day activity status. First-line treatment for osteoarthritis would normally be an oral NSAID, but since this patient has stage 3 chronic kidney disease and he also has hypertension and he's taking the lisinopril, oral NSAIDs should be avoided in this patient. The Norco that the patient is currently taking is not only not guideline directed for treatment of osteoarthritis, but is also likely the cause of the constipation, nausea, and sleepiness. Um, and then based on the elevated AST, the Tylenol should also not be used as a first-line treatment. The duloxetine is also conditionally recommended, but probably not the best choice for this patient because he has that hypertension and the seizure disorder. So for treatment of the osteoarthritis in the knee, because there's no effusion in the knee, a topical NSAID should be used. Diclofenac 1% gel is a great option for topical NSAID, and it's better used regularly rather than an as-needed medication. The Lexicomp monograph for diclofenac and the 2019 ACR guidelines for foundation guideline for management of osteoarthritis of the hand, hip, and knee. They both recommend a dose of 4 grams applied 4 times daily. For the osteoarthritis in the hip, an intra-articular glucocorticoid is strongly recommended for treatment by the ACR guidelines. And then Lexicomp monograph recommends a dose of 20 to 80 milligrams. This is a one-time injection that can be repeated when and if it is needed. And then the dose can be adjusted based on how it's working. And then I recommend stopping the Norco and the Tylenol for this patient. I also recommend starting a diclofenac 1% gel at a dose of 4 grams 4 times daily, scheduled, as well as starting an intra-articular injection of methylprednisolone 20 milligrams. I would also recommend referring the patient to an orthopedic specialist for that injection and to also further assess the back pain slash shooting groin pain. And then I would also recommend that the patient looks into some water aerobics or another form of weight-bearing aerobic exercise, non-weight-bearing aerobic exercise. And then I would recommend that we follow up in about a week. At that follow-up, I'd like to monitor his pain score, his bowel movement, any side effects from the medications, his liver and kidney function, his blood pressure, and then I like to get a CBC and monitor his blood glucose and his electrolytes. The patient should also be getting routine eye exams where we're starting that intra-articular steroid. And the patient should also self-monitor for resolution of that constipation, any reduction in pain, and then any changes in lifestyle. And then I'd also recommend the patient starts monitoring that blood pressure more regularly. Did you have any questions about my assessment or recommendation?
Yeah, you said recommend getting eye exams.
Yeah, just where he's starting that steroid, it can have some systemic side effects, and it's just recommended by, I think it was just in the clinical monitoring on the Lexicomp monograph to get I think it's yearly eye exam.
Oh, okay. And you said that he's on Norco and Tylenol and it's not touching his pain. How much Tylenol was he using daily?
Yeah, he was using over 4,000 milligrams daily, between the Norco and just the over-the-counter extra strength Tylenol. So um, that could be the reason that his AST was elevated. So once again, I would just recommend taking it off completely. We can maybe try adding it back later at a lower dose.
Oh, okay. And so we're just doing the injections and the topical. You're not gonna, there's nothing like daily for the patient?
Yeah, I wouldn't recommend anything daily other than that topical diclofenac for the knee.
Yeah. What about his shooting pain through the groin and um will the diclofenac help with that?
Yeah, I wouldn't say that the diclofenac would help with the shooting pain. I don't think the diclofenac, or I don't think the shooting pain is necessarily a side or caused by the osteoarthritis. So that's why I referred to a pain special or an orthopedic specialist to look further into that pain.
What
Can,
other
can you tell us how you're going to tell the patient to use the Voltaren?
Yeah, just 4 times daily, 4 grams. It comes with a little card, and you can just put it on the card. It will measure out 4 grams. And you're just going to put that on the knee, and you'll use that scheduled rather than as needed because in order to get an effective trial to know if it's really working, we want to use it 4 times a day.
And I just apply it to my knee?
Yep, just over the knee.
Chelsea, did you have anything else? I cut you off, but
In the beginning, you said you were managing his pain, but you mean like because you decided it was osteoarthritis pain, right?
Yeah.
Um, and his blood pressure was elevated today. Why do you think his blood pressure was elevated?
It could be a result of the pain that he's been having, could be a result of the increased heart rate, I
No,
believe he had.
that makes sense. Yeah. And then are there any like patient-specific goals that you have for this patient?
Yeah, so for the patient, I had some goals. Definitely we want to reduce the side effects caused by the Norco. And then we want to make sure that his pain is being reduced. Not necessarily all the way, but we want to get that reduced down to a level where it's manageable. We also want the patient to be able to have normal daily activity and be able to exercise regularly if that can be possible for him.
And did you guys talk about other um like therapies or other things that he can do?
Sorry, could you repeat the question?
Yeah. Did you guys talk about like physical therapy or anything? Is he willing to do anything else?
Oh yeah, I would recommend at least doing some form of exercise, the non-weight bearing exercise. And then if that's not going to work out for him, I would definitely recommend looking into physical therapy to manage that pain, or at least get some form of exercise in to help manage that pain.
All right, thanks, Duncan.
perfect. Okay,
Question?
make sure to upload your recording, okay?
Okay,
Okay, I'll talk to you later.
thank you.
Yep.